So the last class, the main portion that we have seen is nothing but a research process. In the research process, we have seen these following steps like formulation of research problem, and then we have seen how we are preparing the research design. The third one is nothing but developing a data collection instrument or a research instrument. And another one is nothing but selecting a sample. And fifth one is writing a research proposal. Sixth one is nothing but collection of data. Seventh one is processing and analyzing the data. And final thing is nothing but writing a research report. A small recap of it. So formulation of a research problem. This is very important step. This is basically the foundation for each and every research. So why do we do the research? Why do we start a research is based upon the problem that you are going to identify. As we have already seen, the problem should be the real problem, and it should affect the society and our research should be based upon the social welfare only. We cannot be taking one particular problem for our vested interest. Like, so whenever all the research and the focus of the research should be towards the society only. So the real problem should be identified by us, and for that problem, we have to find out a solution. So we have to start a research. So how will you find out the real problem society? So they have listed few of the methods. See, something like we cannot be going to each and every place and find out what is there. You cannot have a little vision, over vision, you cannot find out any problem. For this only, they have listed few of the reservoirs, the data storage units, which is giving you the real problems of the society. The first one is nothing but the literature review. Literature review is nothing but our seniors. Our seniors would have identified a few problems. They would have conducted some research based upon such problem. This may be in the medical field or in the engineering field or any field. The research is already completed. So from that, whatever may be your field, if our field is yoga, you have to take the literature review. So when it comes to the literature review for yoga, PubMed is there, ResearchGate is there, Academia is there, like this, and Google Scholar is there. Scopus reservoir is there. So like this, and Web of Science. There
Shodhganga is also there, no?
Yes, ma'am.
Shodhganga.
Yeah, Shodhganga is our all the Indian researchers are being uploaded. In fact, in Shodhganga, you can see the entire document. Like in literature review, while you are searching for the literature review, in PubMed and all, you will be getting only the crisp of the things. That is a paper like or abstract like only you will be getting it. Few only when you go for a paid version, you can have the entire thing. But in Shodhganga, you will have
thesis we can get now.
yeah.
Whole thesis we can get.
Yeah, entire thesis you can take. Entire thesis you can take. But never think you can reproduce it because there is something called as a plagiarism. All these things I'll come, okay. Plagiarism is a major thing nowadays. All the universities are following. Unless otherwise your document is cleared with plagiarism, you will not be allowed to submit. So you should know what is plagiarism. So plagiarism is nothing but there are many softwares to trace it out. Right now, Urkund is being identified as a plagiarism software in many universities. It's recommended by UGC. But nowadays, for NAC upgradation and everything, people are following Turnitin. Turnitin is nothing but a software that identifies the similarities between what is being given and what is being in the web search. It will take all the paid free versions, Urkund will not take, there is an opinion, I'm not very clear about it. There is an opinion that Urkund is not permitted to take out plagiarism from the paid versions. Like, so it is, since it has become a free software, that's why, but Turnitin, since it is a licensed one, it can go into all the paid version field and it can take out the data and it can pair with what we have already submitted. So, but Turnitin will give only similarity in this. It will never say in that documentation that it is plagiarized. That word won't come. It will just say it has similarities only. So from the similarities, it is up to the university or the professor to say which is plagiarized and which is nothing. But for example, when you take review of literature, okay. So in review of literature, the name would be, few names would be repeated very often. And the titles also, the variables also, often it will be repeated. So in Turnitin, it will say, it used to say that these things are similar, like even the medical terms like BMI, thyroid, all the medical terms, blood, and hemoglobin, everything it will say similar only, because we cannot change the name like now. And even your title will be shown as similarity only. Even the title of the research will be shown by the Turnitin as similarity only. So that is why they have already given in their SOP that the similarity will alone be identified, and it is up to the professor or the research department to say which is plagiarism, which is not a plagiarism. So why I am telling this, in everybody in Show the Ganga, all these things, entire things are being uploaded. So if you are very new to the research, do not try to reproduce anything from there. So you will surely you will be identified under plagiarism. So that is what I am trying to just caution you people. And then from the literature review, from the main thing is that from the literature review, you can identify the similarities between your problem and what the our seniors have done it. But while you are reproducing it, you have to change the wordings. You have to write your own wordings alone. You should not reproduce what is there in the literature review. You should not copy and simply reproduce. You have to read the literature, what is already given, and you have to write it in your own terms. That is only advisable. And then, depending upon the literature review, you can formulate your own objectives. See, formulation of objectives is very important. See, your whatever the objectives that you are giving in your proposal, that should be proved in your research report. See, you will be forming like 6 to 7 objectives, like those objectives you have to study very carefully, because those objectives you have to give in your research report. You have to say the identified objectives in the proposal is achieved by me, or you have a little variation in the achievement. So like this you have to give. So identifying the objectives are very much important. For example, when your topic is nothing but low hemoglobin version of some female age group, you can take. So resolving lesser hemoglobin with yoga or with your diet. So it must be in your one of the objectives. And the second objective should be thyroid. Okay. So you have to, in the objectives, you have to mention with the help of yoga and diet. And this research has planned to resolve the hemoglobin deficiency of female candidates with the age of like 10 to 20, and even the thyroid imbalance from same age group of 10 to 20. So these things with your yoga practice and with your diet practice of the planned time, and when you are submitting the final report in the research, you have to see the, as I have already told you, in the statistical calculation, there should be improvement, because you have already assured in your objectives that with your practice, you are going to resolve this issue. So as I have already told you, if you have failed to resolve it, or if your result has proved that as expected, for example, the hemoglobin count of the pre-test is that, like, for example, 10.5. So nowadays, the for female range has increased to 14.5. If you couldn't make it to 14.5, at least with your yoga practice and with your diet, with the, for example, maybe our therapy time, we have assured us 12 weeks. Within 12 weeks, at least you should be capable of bringing it to 12.5. Okay. So such a sort of nearby things you can make up. But if your result is only 12.5, you are not supposed to manipulate into 14.5. This is what is being expected in the research. So like this, while you are formulating the objectives should be practical and it should be achievable. That is very important. And then Identifying the research variable and measuring this case. That is what I have already told you. See, you have to identify which variable you are going to take and how you are going to measure it. See, like hemoglobin means blood test only, we are going to prove it. Like that, how we are going to measure. If you are taking the psychological variable, there are many questionnaires. A standardized questionnaire is alone allowed. It is not, it doesn't mean that you have to take only the established questionnaire. We ourselves can form a questionnaire. There is a procedure to make our questionnaire standardized. Like, so you have to form one questionnaire, like a minimum of 50 to 60 questions you have to make it. And the first step, you have to circulate again first level of group, like 60 members you have to circulate, and you have to find out and analyze the answer out of it. And second level, you have to circulate. Like this, to make it a standardized questionnaire, they have few steps. Those steps we have to follow, and we can make our questionnaire as standardized questionnaire also. So then the next one is this hypothesis. Hypothesis is nothing but an intelligent guess. That is what is our intelligent guess? We predict that because of our yogic practices and the diet, we could resolve the hemoglobin level and balance the thyroid stimulating hormone. Okay, that should be a normal thing. See, this should be an intelligent guess. Like, but suppose we take a cancer patient for us for treatment. You cannot simply guess that cancer will be resolved within a period of 6 months, right? This is not an intelligent guess. We may try to resolve, for example, a breast cancer, or we may try to extend the life of the patient like this, depending upon the patient situation and the doctor advice. We have to formulate the hypothesis. The hypothesis should be really practical, that is achievable. That is very important. And next comes research design. The designing
Excuse me,
research.
ma'am.
Yeah,
What is null hypothesis? There is a term called null hypothesis.
yeah,
which
that
is
I'll come. That I'll come. Hypothesis is a very big topic. That I'll come. Now, if I take null hypothesis under research process, we'll stop now. Okay. So bear with me for one class, and the next class is only going to be hypothesis. There I'll explain everything. Okay. Now, because in the research process, null hypothesis is nothing but you don't achieve a thing. That's all. There comes, for example, then statistics, we take some reports, as I have told you, you can take even the hemoglobin example, the pre-test for 20 members and the post-test for the same 20 members. Maybe you have already selected your statistical method as t-test. Okay. And in the t-test and final result, the comparison will be in ANOVA, you may take it now. There is on statistical table, always a statistical table is there in which the standard, if you take this much of thing, the standard unit should be like 4.21. If it is 20 members, 4.1, like this, they have formulated a table. Okay. So our result should match it. Suppose your F ratio is lesser than the statistical table. Like log table, in statistics, you have an F table. So if it is lesser, the F ratio table. If your result is lesser than the F ratio table, your research is not proved. Okay. For which you will not be, they won't say that you are not going to be rewarded with the PhD. You will be rewarded very much with the PhD, but you cannot say that your hypothesis is successful. There comes a question of null hypothesis because we are unable to prove it as we have planned it. You understand? So there comes a question of null hypothesis. Generally, null hypothesis is not nowadays coming to many people. Like, there is an, if I expect 14.5, as I have already told you, at least to 12.5, we could make it out, right? It is practical. So guides will be there and the people will be there. They won't allow you to reach that state of level. Okay. So in null hypothesis, I will go in depth in the next class. Are you okay with that? Shall I proceed? I think Gunjan has said.
Yes, madam.
Yeah. So another thing is that then the research design. So depending upon the problem and the study design, we have to formulate the research design. Generally, two types of research design is famous nowadays, the experimental study and non-experimental study. Our yoga and medical studies are coming under experimental study only, because we apply our methodology on some human being, we experiment our methods. So this comes under only experimental. Non-experimental cases, like when you go for literature study, when you go for history, so those type of archaeology, those type of researches will come under non-experimental studies. And then comes the developing a data collection instrument. So generally when it comes to medical physiology, so this data instrument is very much important. So what is this standardized instrument? The current instrument is very much important. We cannot go with the past very old instruments, because nowadays everything is digitalized. So we need to get a exact accurate report. So depending upon the data, we have to find out with the lab which is the current instrument, and we have to take the advice of the lab technician. With their advice only, we have to decide upon the instrument. And of course, doctor advice is very much important in that. We ourselves independently cannot decide the instrument, because we don't, all of us will have idea only with our field, whether it is medical or whether it is yoga. But regarding the lab instruments and the how the thing is going to be decided, everything, we are supposed to take the advice from our doctors as well as from the lab people. So depending upon their advice, we are going to decide upon which instrument is going to be decided out of it. And next is the method of collection, how you are going to collect it. See, generally, data collection will be allowed by the universities, like, no, how frequently you are going to collect, what is the span that you need to collect the data. So here data, they mean the pre-data as well as the post-data. What do you mean by pre-data? Before starting the research, when we have identified the subject, we give the questionnaire. Depending upon the questionnaire, hope you all remember. In our sample, we'll use to give the questionnaire. Depending upon the answer, we filter our particular subjects, and with their consent, we will be starting our treatment. So immediately when somebody says, I am diabetic, when somebody says I have very low hemoglobin, I have thyroid imbalance, is it advisable to start a research immediately based upon whatever the medical record they have? Are you all there in the class?
No, ma'am.
No, ma'am.
So what we'll do, it is our duty to take a report first. We have to test all their, whatever the variable that we have decided for our research. After deciding the variable only, we will be starting the research. So data collection is the stage. It is nearly just on, you will identify the research problem. You have identified research problem, and after identifying the research problem, you have just formulated all the research design and the methodology. Now you have also decided the instrument with which we are going to start the research. After deciding the instrument only, you are going to start the data collection. So the pre-data collection is the next step. So all your patients should be tested with your variable. For example, hemoglobin to be tested, thyroid to be tested, and H1ABC, maybe you may have. So all these things to be tested before the starting of your treatment. That is very important. That is only called as pre-data, the normal English word, pre-data. After this, we will be starting our therapy. See, like 1 hour yoga, you should have scheduled, like immediately start to begin with, you will start with a prayer, then you will go for the Chalana Kriya, Surya Namaskara, and asana should have been planned, and breathing, and whatever the meditation methods. Like this, we would have designed our methodology, how we are going to treat. And if your diet or any other another intervention, that will also be decided. So all the schedules would have been given to the university, and based upon that, with the pre-data, after the pre-data, you are going to design a research tool. That is what they are telling. You are going to, your tool is nothing but what the intervention that we have already decided. After this, what will we do? We will be taking the post data. maybe the 3 months of our training, we will again take the post data. So we have to compare the pre-data with the post data. We have to find out whether there is an improvement in that. So, for example, if you have 60 candidates, you may find out an improvement in the 40 candidates, right? That is a data collection stage. So that report should be very true. And then we will be giving the research proposal. Yes, I have done everything. Because here the data collection, the methodology data collection is nothing but a pilot study that you have done. So after that, you will be giving the proposal, and the proposal, after the proposal, all these things over, you will be really ordered for the original research. That is why they say collection of data by observation interview. So after proposal only, you will be going for a real research. So after all these things, again, the pre-data and post-data will be collected for the entire lot of your sample. And then again, we will be analyzing. That is why they are telling editing and coding. Classification of your data will be classified according to the variable. For if you have 8 variables or 6 variables, all the 6 variables to be separately analyzed with the pre and the post data. And then you will be justifying with your hypothesis with the previous literature review. And finally, you will be submitting your research report. So how we research report? There is a method of for doing it. First is your title should be there, and then the table of contents. The table of contents should be carefully formed, that it has to give the whatever inside the your research report should be identified only with your table of contents. So that should be there in our mind. So it need not be too elaborate and need not be too short also. So it should be to the point. Whatever there in the contents of your PhD report, that should be in the table of contents. And the chapters, we have to make it as per our university norms. Whatever, few people make it 5 chapters, few people 6, 7 or 8. Whatever the university norms, regarding that, you would be getting the instruction according that the chapter to be formed. So first chapter will be the introduction chapter. Then second chapter will be the review. In the review, you may be asked to give the current trend is 73 is mandatory. Like you can go for 80 reviews. Now, a review should be covered to all the variables, not a single variable. Like no, you may be having 80 variables. So after all the variables, we have to take the reviews, and then and after the reviews, the third would be your methodology. Whatever the treatment that we have given, that should be in the third chapter. And the fourth chapter will be your results. What are the results? The statistical analysis, the graphical presentation. Because simple table will not be sufficient. You have to give it in the graphical format also. And then the discussion is very important. In the discussion chapter only, our intelligence is shown. See, intelligence of a researcher is shown in the 2 chapters. First one is the introduction chapter. Introduction chapter is very important. In the introduction chapter, we have to talk about the disease, our disease in a very precise and a presentable way. And then your intelligence is shown in the discussion chapter. How you are presenting your research is very much important. Whether one variable, as I told you, whether you are unable to get a better result in the biomarker, that is also not counted. But how you are giving the report, how you are discussing is, there comes your intelligence. And then next you will be giving the bibliography. Bibliography means it is better to show everything in the bibliography. Like you have to classify it single author, 2 authors, and more than 2 authors. How you have taken the research review, literature review, whether it is from the conference or from the journals. All these things we have to go. In appendices, we will be giving our total data collection reports, how raw data. In other words, we will be giving the raw data. That is why I told you in Shodh Gangotri, if you take any research, everything will be there. So you don't try to copy the appendices, because people nowadays, the trend is that really few. I'm not telling good people like people, but there are few people where they don't do real research. They take the data of others and simply make it little manipulation they present it. So nowadays this is not possible, because the software plagiarism, it will find out where and all we have went, and it will find out, it'll just simply give a big list where and all we have copied, and everything will be there in the plagiarism report. So that is why I say we can refer, but we are not supposed to copy. So next comes research problem. The first step, the very first step of formulation of research problem. So that we are going little in detail. So what is that? It is nothing but a problem is nothing but it is derived from a Greek word. All the English basically from Latin or from the Greek word, right? So similarly, this problem is derived from the Greek word probella, okay, which means anything thrown forward. So whenever there is, when we say it's a problem, how will you know the problem? Unless otherwise I express that I have a problem, nobody will be knowing, right? That is why they say it is nothing but thrown forward. And there are some difficulties, research experience in obtaining the solution. Yes, naturally. So whenever the problem is coming, it is not that much easy to get a solution, right? So similarly in research, each and every research, if you are a regular scholar, at least 2 years you have to be there in your university. And if you are a part-time scholar, at least 4 years you have to spend. So finding a solution takes at least 2 years or 4 years. Like, see, it is only the period that we are going to be in the university, but completing the research and something and submitting the research report will take another year also, right? So that is why they say this is not an easy thing. It is really a tough thing. Finding out a problem and then finding out a suitable solution is not such a easy thing. So that is why they are telling how to locate a problem. They are guiding us, our seniors who have already done the research. They have formed some guidelines how to locate a problem so that it will be easy for us to identify the thing. So professional reading. Professional reading is nothing but not only literature review, and for every field we have our own journals. Many journals are coming nowadays. E-journal is there, hard copies are there, and each and every institute, universities are having their own journal. Like Kaivalidhamma, they have their own journal. Like this, all the universities almost have their own journal. So such a professional reading, a regular reading is really helpful, where the real problems are regularly discussed by the experts. And then classroom discussion. Yes, classroom discussion is very much important. Because when you listen to your lecturer or the professor, what they are discussing, generally lecturers will give the current trend. When you are discussing about any subject, the current trend will be discussed. Current research, what are research findings will also be discussed by lecturer. So from that discussion, we can find out which topic will be suitable. If you are in MSc, you can start observing your lecturers very carefully so that it will be helpful for you to finalize. If you are interested to continue with the PhD, you can identify the problem with the lecture itself. And then next is the seminars, conference, symposium, and assignments. Yeah, after you are coming to this research and the NET exam, we are in the yoga field, no doubt about it. Taking yoga therapy, yoga classes is very much important, no doubt about it. But if you want to grow further in the field, you have to go for more seminars, more conferences, more symposiums. You have to go there. There, the real persons who have already completed the research would be presenting their own papers. So that is really a good exposure. You can interact with them. You can observe the lecture. You can question them. So this is very much important. So, and the assignments, you have to go further, right? Like only when you are going to the seminars and the conferences, we will be developing our knowledge, right? And then as the what we have already seen, analyzing the literatures. So if you are going to the seminars and the conferences, this literature review will be analyzed in a better manner there. See, the perception differs, So when you are reading literature, our perception may be different from the original presentation. So such a doubts and the clarification, we can take it from those seminars and conferences. So after clearing, I'm sure you will be all will be clearing your NET exam, and make it a habit whenever the conferences are being posted, hosted. do attend it. Maybe if you are a real fresh scholar, means your fee will also be very less only. Just allocate from your fund for these conferences and seminars. You can also present your own papers. So it will count to a real experience. And then area of your special interest. So my suggestion is your special interest would have developed while you are taking the classes itself, no doubt about it. But only when you attend the seminars and conferences, you will really identify what is your own interest. Like when you listen to the maximum lecturers, we can identify our real interesting field. And then former studies. That's what. So our previous studies are, yeah.
I'm fine.
Sorry. Now our previous studies are very much important to identify the things. And then criteria. This is also continued. These are all the many ways they have listed. So controversial issues, no? See, for example, when you both are, I mean, here I think there are 9 therapists, okay? So when a person comes with a spinal problem, everyone will have your own thoughts. No? People, I think first class we discussed this. Karthik ji said forward bending, and SVS they are giving forward bending. People say don't give forward bending. Like it is literally a controversial issue only. So out of these controversies only, we can develop a wonderful methodology. Because I will say don't give forward bending. Karthik ji will say no, our universities are giving forward bending. Then we will both sit together and analyze. I'll say why I am not giving forward bending. Karthik ji will say why you have to give forward bending. So like this, only when the controversy arises, the real solution will come up. And then ongoing research projects. Yeah, you can see now many research institutes are there. Government is also encouraging. Government is now giving so much of money to do the research. The huge fund is allotted for higher education. So those, if you just observe all these research projects, you can take up those research projects also. We can involve ourselves and we can complete those projects also. And then again, completed research projects. Same in the research institutes, you can see what are all the projects that have been already been completed. From this, you can see their suggestions for further research. That is very much important. If you see their suggestions, from there itself, you can identify some problem and you can start doing your own research. And then important thing, consulting our faculty members. Yeah, our faculty members will have wide experience. They would have seen many people, they would have seen many problems also. So they are really a knowledge bank. From them you can collect, you can identify what is a real problem and what is a, if you do that problem, can you find out a solution? Because we are not supposed to take any complicated things, no. See, only when you can give the solution, you have to start the research. So how can you know that which problem has a solution? Only when you have a discussion with the experienced people. So your travel will be really smooth. And then naturally consulting with yoga experts, no doubt about it, you are all yoga experts. So you can have an own interaction. Then comes journals. Journals are very much important. So now nowadays reading has changed nothing but instead of hard copy, we do e-copy, that's all. Then existing theories and practices. Existing theories only you are all studying, na? Hatya Pratipika, we are going to study Ganta Samhita. These are all the existing theories only in Upanishads. So these things will give us a better idea to identify the problem. See, they have told how to live. Na? Nowadays, if you read all those things, you can identify what are all the problems nowadays existing in the society. And then the practices. What are all the practices, traditional practices, if you know, you can identify what are all the deviations nowadays. So from that also, you can identify the problems and go for some research. Then audio-visual programs. These things, audio-visual programs and all, if you go for a research seminars and everything, there'll be a lot of audio-visual programs. And naturally, case studies. Case studies is very much important. No, it is different from research paper. Case studies is an individual case study. Like one patient, they would have discussed about a particular patient, how the patient, some few critical patients would be there now, how the patient came with the problem, how that problem has been resolved. So case studies are very much useful. And then innovative areas, naturally, when you come to the any scientific field, innovation is very much important. So innovative areas, we have to keep on updating ourselves. And then naturally the personal experience, as that day Sakshi said, the breast cancer, personal experience is also very much important. And finally, they come to the current social problem. Always our research towards the current social problem only. And then, so, and you have identified some problems, okay? Then as I have told, all the problems, though we cannot decide the solution with the emotional aspects, right? That is why they are trying to guide to us. After identifying the problems, how you are going to select it? You would have identified 2 to 3 problems, right? Even some people, even in the while you are taking the PhD, you will be asked to give 5 topics, nothing but identifying the problem. Out of the 5, university will give us 1 or 2 topics, and with the guide we have to discuss and take it. So that is what they are guiding us, how we are going to select the problem. So if you are a yoga scholar, you have to give related to yoga. So previously, when I was doing MPhil during 2014, I selected a problem that media addiction to adolescent girls. Those time, this measuring of addiction was not developed. So immediately I was told, see, how will you measure? What is the yardstick to measure the addiction? So I don't have an answer about it. So medically, the tool was not developed during 2012 to 14 I did. So that time we didn't have a tool. But nowadays, this is the current topic now. Wherever I see the people have the topic of measuring the addiction, resolving the addiction of media, addiction of adolescent boys, college boys, like this. Because nowadays the tool has come. They can measure the addiction. So like this, so it should be related to yoga. The tool should have nowadays developed, that those days not developed. So that knowledge we should have, whether there is it is related to yoga, because our main topic is only yoga, right? So without yoga, it is very tough. Maybe few people are strong with Ayurvedic or Varma. So whatever the field, your field, it should be related to that field. And naturally, next thing is familiar and feasible. See, when generally in university, when you take some interventions, right? If you take yoga or if you take diet, they expect at least a diploma or any qualification you should have in this. See, for example, in yoga, you need a PG, right? And if you are taking additional Varma, you should have at least diploma in Varma. Else, they won't allot you with the allied ones. So similar, that's why they say familiar and feasible. Not only familiar and feasible, you should have a qualification also. And then should not be overdone. So these things are simple only. Controversial subjects to be avoided. That's what I say. For example, any during COVID season, if it is an open experimental, like if you want a challenge, you can go. But when the solution itself is not developed, if you have taken it as your research topic, how will you end it? Nah, because a few of the COVID patients were saved and few of them not saved. So like this, any unending issues, when the solution is not clearly established, it is not advisable to take it, because our research time will keep on be extending. We will be our topic will be under controversy. So a few people external will accept, few may not accept our thing. So that is why they say do not get into any controversy like. And it should not be too narrow or too vague also. Okay. So your topic, your title should be very clear, and it should not be very narrow or vague. It should be very, very clear. Like, for example, a treatment of anemic person with yoga and diet. Simply, you cannot give that a treatment of a person with yoga and diet. What you are going to treat, that should be there, right? See, treatment is any treatment only. You cannot, you cannot take treatment of a person with yoga. What you are going to treat in that particular person, like I am going to treat anemic, I am going to treat diabetic. So like that, it has to be very clear. and it has to be relevant. These things are only repetitions, like. And then you have to give consider, we should have our own training. The training period should be practical. So maximum of maybe 6 months we can give. You cannot, because if you put a long training, what would be the problems you will face? Can anyone say?
Availability of the participants.
Exactly, you will not have the continuity. Because naturally you cannot go for all the unemployed persons, like you will, subjects will be mixed, that employed will be there. And probably even if they are you, for example, if you go, as I have told you, take one company and like policemen, if you're going to give your training in the premises also, they'll get transfer, right? So maximum of 6 months should be there. So even in the 6 months also we will be facing the problem. That's why we are taking the consent. So they may go on transfer, their shift may change. Like this will have a problem. And the cost factor, that is very much important, right? We should be practically, we have to bear. And if at all the subjects are ready to take their own test, it should be a reasonable one. Naturally, a time factor. Frequently, we cannot be, only pre and post is advisable. In the middle and every week, if you want them to, out of interest, out of anxiety, if you ask them to take their test every week, means naturally it is not practically possible. It is not good also. So those things we have to make a matured plan. And then the techniques and the tools, as I already told you, they should be nominal, they should be practical, and cooperation of the subjects are very much important. No, subject alone should not cooperate. We should make them cooperate. We should be pleasant. We should be very friendly with them. We should understand their own problem, and we should make them understand that we are giving training only to resolve their problem. See, you should make them realize that you are really treating them. You are really helping them, right? And that feeling we have to initiate in them. Our treatment, the way in which we give the training, they should give the same pleasant feeling to them. They should not feel that this girl or this lady is just torturing me for her own research. That feeling should not be there. No? Our treatment of the subjects are very much important. And then we have to take a proper guidance, and we have, that is what everything comes under research design only. You have to have a proper guidance and a financial help. Suppose if you are doing any big research for the welfare of the society, and if your funding is not sufficient, so we can represent our university in which we are doing, and surely we will be getting the financial help out of it. So I think with this we may end, because identifying the problem and how we are going to deciding on the problem is very much important. This is not only in the examination point of view. I wish and hope that you are all get into a PhD, and there you have to, you should know before to choosing a particular topic. So if there is any questions, you all may please ask.